Hi, I'm Gil Stillings, the owner of Atlantic Insurance Solutions. I'm a full-service broker, all kinds of insurances. I deal primarily in health insurance. I'm really glad that you took the time to visit my website, and I'm going to answer some questions now that are typically asked by my clients or by my prospects, and I think this will help you to understand a little bit more about what I do and why my services are valuable to you. What is an insurance broker? A broker is somebody who has appointments with several different health insurance companies and also life insurance and so forth. I myself am appointed with probably 45 different insurance companies. That enables me to find a product that best fits the client's needs. You'll also run into what are called captive agents. And an agent is somebody who works for a specific company, sells for that company. But the downside is that too often with an agent, he's forced to fit you into the few plans that he has. So my advantage is that I represent a lot of different insurance companies, have access to literally hundreds of different insurance products, insurance plans. So once I speak with you, find out exactly what your needs are, I can tailor the product to fit you. Do I get paid by my clients? Actually, no. A broker gets paid by the insurance company, and they take it as part of their advertising budget. So it doesn't add anything to the cost of the product for the client. So in simpler terms, when you buy an insurance policy from me, if we ran a quote from e-insurance or anybody else where you didn't have an actual broker working with you and picked the same exact plan, the price would be exactly the same. In addition, as a broker, I can find you all kinds of plans that you will never find on your own. And it still costs you nothing to have my services. It's just part of the cost of doing business for the insurance company. So there's no reason not to use a broker. It costs you nothing. And no, you're not paying me specifically. The insurance company is. Why bother to use a health insurance broker when you can buy a health policy online? I alluded to this in the previous question or answer, but I think it's important to note that brokers have access to so many plans that you'll never find online, because I represent companies that may not advertise online, and also, like, I have a website myself that you can run comparison quotes, and there are probably 4 or 5 different insurance companies, Humana, Aetna, United Health, that are loaded in there, and you can go over a huge menu and try to find a product that'll fit you. But I have 20 companies that I can choose from. So we can broaden your choice dramatically and tailor the product, as I said earlier. I like to use the analogy of a travel agent. Many people, a few years ago when the internet became so popular, and I was one of them, I always used a travel agent, and then I realized I could plan a trip to Europe myself. I pick out the hotel, book it online, book my own flight and so forth, and that's what I did for a few years until we ran into a problem on a trip and had nobody to call. There was nobody at Expedia. And from that experience, I learned that it's helpful to have a travel agent. When there's an issue, I can shoot an email, make a call, and get some help and support. It's the same thing with an insurance broker. You can buy a policy online, but who's going to be there for you if there's a problem, if you lose a card, if you're not sure about the policy? So it's worth having a broker because A, I'm there if you need me, and B, I have access to a universe of products that you can't find on your own. It's impossible to know how the Affordable Care Act is ultimately going to play out in the United States. It's in court now, and this could go on for quite some time. What we do know is that two important changes have already taken place that I think are affecting consumers in a really positive way. For one, children can now be on their parents' policy through age 26. So that's answering a big need, especially in the economy that we've had when a young person is out of college or it begins a trade maybe and doesn't have health insurance from a job. Now they can go on their parents, stay on their parents' policy up through age 26. So that's a real blessing. Secondly, on any major medical policy that was purchased after January 1st, 2011, all preventative services are covered immediately and at no charge. So that means an annual physical, your blood work, for women, a mammogram, pap smear, for anyone age 50 or over, a colonoscopy. All these services are covered free of charge. No co-insurance, no deductible, no copay. And the idea of that was to try to help people stay healthy, to keep down the cost of healthcare long term. So those two things are not going to change, and they made an impact. They're helping consumers, and we'll see how things evolve going forward, but at least we know that much. I'm Gil Stillings, the owner of Atlantic Insurance Solutions, and I want to thank you for taking time to view my video and to go on my Billboard website, and know that I care about you. Will do all that I can to make sure we get the right product at the right price to protect your assets and to give you the benefits that you need and will use.